The success of combination of hypomethylating agents with Venetoclax in older and unfit patients with AML has been generally well recognized. Now it is the standard of care whenever this is available, and clearly is much better tolerated and is very effective therapy for these older and unfit patients. Of course, this requires administration of azacitidine or decitabine parenterally, which means their attendance in hospitals or hospital offices in order to get this, and this is usually 5 to 7 days in a row. And for older unfit population, this can be quite a lot of problem and inconvenient. And of course, we now have oral hypomethylating agents available, and we combined ASTX727, which is an oral formulation of decitabine and cedazuridine, with Venetoclax, and this abstract is the result of this phase 2 study in the frontline older AML population. If you exclude the patients with prior MDS who had received prior decitabine or azacitidine, which are recognized as being a very tough population and were excluded from the VIALE-A trial. If you exclude those patients from our study, the responses and duration of survival or median survival is actually quite comparable to the VIALE-A study, and particularly that the median age of the population in our study was 80, so it's actually a bit older population than the VIALE-A study. This essentially means that we now have a completely oral strategy for frontline treatment of older AML patients, which again is going to be a lot more convenient for these patients.